Globally, some 25 million unsafe abortions occurred every year between 2010 and 2014, according to a study by the World Health Organization. The majority of unsafe abortions, equating to 97%, occurred in developing countries in Africa, Asia, and Latin America. In developing regions, it is estimated that 220 women die for every 100,000 unsafe abortions. Statistics in Guyana are limited, but there have been reports of women dying as a result of an unsafe abortion. In 2012, 18-year-old Karen Badal, a mother of two, died after sustaining injuries during an unsafe abortion. The Evening News recently sat down with Salima Bacchus-Hines, a program manager attached to the Ghana Responsible Parenthood Association. According to Bacchus-Hines, a significant number of women still perform unsafe abortions.
Unsafe abortions happen when there isn't access. And, if a woman does not want to continue a pregnancy, she's feeling desperate, sometimes people try things at home. They try things that, a friend or a neighbor, auntie advised them, or they go to the pharmacy and take medication that, they're not supervised or they're not given the right dosage, and it causes harm.
However, Dr. Natasha France, director at the Obstetrics and Gynecology Residency Program, is urging women to do it the right way. In a short film produced by the GRPA, Dr. France explains that using pills obtained from a pharmacy may not be safe.
Most time they would have used misoprostol or Cytotec, and this would have been obtained from a pharmacy. Sometimes they may have used other concoctions like different types of medications and drinking it to induce an abortion. Severe patients would usually stay in. Some may have to be treated for infections. Some may have had blood transfusions. Others may end up losing their uterus.
But why do unsafe abortions happen? Apart from the issue of being taboo, access to safe abortion services is limited.
It isn't very accessible, unfortunately. The majority of the services tend to concentrate in Georgetown. And so the further out you get, from Georgetown, the harder and harder it is for women and girls to access the service.
An independent investigation by this newscast found that the Georgetown Public Hospital and the New Amsterdam Public Hospital are perhaps the only two public health institutions that offer the services. While the services are also offered privately, it is often costly and mostly only available in Georgetown. This means that persons in the hinterland regions and other far-flung areas are placed at a disadvantage. While more work needs to be done to ensure access is improved, women seeking abortions are encouraged to visit a doctor.
Patients, we generally discourage you from going to pharmacies and getting medications and inserting them or drinking them. A lot of the times the medication that is prescribed to you, it's not the correct type of medications you may need, because one of the medication that you may need is not available at most pharmacies. Two, a lot of the times the medication you're getting is the incorrect dosing. So instead of it helping you, what you might find is that you might start bleeding, and then you might continue bleeding because the dosage was not enough to help pass the pregnancy. So we are discouraging you from going to pharmacies to use this medication. Instead, come into your providers, come into GRPA, GPHC, or any other trained providers that provide the service, and get it done safely. Once it's done safely, we can assure you that you may not need to come in again for any additional treatment.
Reporting for the Evening News, Davina Samaru.